The hoarse cough, the runny nose, and the watery eyes. These symptoms seem to creep up on your child every year. But the over-the-counter cold medicine you usually rely on may not be an option anymore. Hello, I'm Susan Crawford for Children's Mercy Hospitals and Clinics. Several studies show these products are not effective in children under 6 and can have potentially serious side effects. The experts at Children's Mercy explain how to treat kids' colds without drugs.
Your lungs sound so good.
19-month-old Christian gets a clean bill of health, something his mother hopes lasts all through the cold season.
A lot of times I really hesitate to give him anything, much less, I usually call a doctor at that point, and find out what her best suggestion would be.
So, but if they say cough suppressant or decongestant,
Nothing.
they're really not recommended.
Okay.
Well, there really is no medicine that's going to help with a cold very much at all, besides the Tylenol or the ibuprofen. There are no cold and cough products that are recommended for children under 5. Instead of that, we try to look at why the child is coughing. Can I see in your ears?
Dr. Simpson says the cough can be a result of allergies or asthma, in which case a prescribed medicine is the best bet. Or it could be just a plain old cold. In that case, there are a few things you can do to help your child feel better. Make sure she gets plenty of fluids and rest. Use a suction bulb to clear his clogged nose. Add a cool mist humidifier in her bedroom. Give acetaminophen or ibuprofen as recommended by his doctor to alleviate pain or discomfort. Finally, some chest creams with menthol or other fragrances can ease stuffiness. Be sure to check for age restrictions.
In many cases, the cough is actually helping the child. It's keeping the secretions from pooling and decreasing their chances of getting infections like bronchitis or pneumonia.
And let's not forget Dr. Mom's remedy.
Does he like chicken soup, chicken noodle soup?
Yeah,
Good,
definitely.
good.
So that's the thing to use.
That's a good cure, right?
If your child's virus doesn't seem to go away or seems to get worse, call your pediatrician. Your pediatrician will let you know what the best treatment is. In some cases, all you may need to do is make sure your child gets plenty of rest and eats a balanced diet. In other cases, your child may need a prescribed medicine. For more expert advice, visit our website at www.childrensmercy.org.